Hello and welcome to the Life Without Limits Family Wellness Show. Today we're going to go in a little bit of a different direction. We're talking about wellness mentality versus an illness mentality. But before we do that, I'd like to relate a story. I was talking to a practice member in my office and we were talking about children. And she was letting me know that her child had been ill and that had ear infections. Now the daughter wasn't being seen, was not being seen in the office. And so when I mentioned to her that children oftentimes can be subluxated or be affected by stress in their nervous system or in their spine, just like anybody else, she was interested. She was interested because this child was to have tubes put in. And doing a tympanostomy, while they're very common and sometimes necessary, isn't always. And I don't mean that from the sense if your child's scheduled that you shouldn't have that done, but there are different options. Sometimes when a child has a subluxation or misalignment at the very top of their neck, the muscles along the neck tend to tighten up to brace or spasm, and that's normal. And when that happens, the lymphatics back up, which is the drain for that part of the head and sinuses, nose, throat. If this stays for a long period of time, then very often that child or that adult will cause backup in their sinuses, chronic sore throats, ear infections, and so on. So I just mentioned, not because chiropractic is a treatment for ear infections, but if a subluxation is present, and that can be addressed, very often the body can heal. And the wait-and-see approach, which has been proposed in the British Medical Journal and even JAMA recently, is indicating that this may be the best way to go. So we checked her to see if she was subluxated, and in fact she was. What was the real issue here was the mother didn't understand how a very young child could have that micro misalignment, which is what a subluxation is, in there, causing that kind of change in her daughter, who is so very small. So we talked about for just a second something called the KISS syndrome, which most of you know generally stands for keep it simple, stupid. And that's not what we're going to talk about, although I will try and keep it simple. But KISS syndrome really stands for kinematic imbalance due to suboccipital strain. Now I know that's a mouthful, but what this really means is very often when children are being born, the stress of birth that's placed on their head and neck region, especially from the pulling or twisting, even if forceps or vacuum haven't been used, can be significant enough to actually cause a subluxation there. And very often, the first subluxation anybody ever receives is during birth. Now, this isn't because the obstetrician is doing something wrong. It's the procedure they use. There are a lot of ways to go about that, and unfortunately that's not what today's topic is about. But different methods of birthing, the LeBoyer method, among others, is very, very effective. And there are different ways to really explore that, and you have to talk to your midwife, your obstetrician, whoever it is that you're dealing with regard to that. But with regard to KISS syndrome, if this is present, what was interesting was that when we have this, we're talking about a really little tiny area of the spine. In fact, it's the very first bone, and it's shaped like a donut. But within that donut is where the nervous system is, or the spinal cord. That spinal cord region in the center of the donut is the most important area. If this donut gets affected, if it's misaligned in any way, and we're talking about really small changes, there's little fibers that connect right from the inside of this donut to the spinal cord. And those fibers are so strong they will not change. They will not rip or tear except under massive stress. So because they won't rip or tear, they will put pressure on the cord, and this deforms the cord. And what I mean by that is there's very large pathways in your spinal cord, if we're looking at it this way, like a big straw. And those pathways are what convey that information. Well, on the outside of the cord are the largest pathways. That happens to also be where those fibers connect. And if those fibers are connected at that level with those large pathways and they're being affected, they are literally pulling on the cord at that level. What this means is that they have a tensile strength, meaning you can't tear them apart, of greater than a steel-belted radial tire. And so if a subluxation is present, these won't tear and you start to deform this area. What you do is you affect every place, every part of the body that these nerves that are coming off of here go to. And so if they go to the muscles, then we have stiff muscles. If they go to organs, we have organs that may be increased in their activity level or decreased in their activity level. In either case, we're losing balance. So with these children, the study that was done, which was actually done by a German facility, found that these kids can have facial asymmetry, where one side of the face is kind of squished up and the other side looks normal. They can have a scoliosis. They can have all manner of behavioral disorders, as well as chronic ear infections and other types of upper respiratory events, sinus infections, throat infections. So after we spoke about this and she got a little more educated and we decided to go ahead and adjust this little girl, the good news for her was she didn't end up having the tympanostomy, not because chiropractic is a cure for ear infections, it's not, but because when those ear infections are being caused by the body's inability to heal that area and there's no longer any interference to that process or interference to that communication process, the body does heal, and it will heal, and it'll heal from an amazing number of things. So for her, this was a big deal. Tympanostomy, while it is a surgery that's performed very often, still requires that child to be put under. So anesthesia, kind of a big deal for them. If we can move in this direction, or at least begin understanding this, it's not so much that we want to go out and now we need to treat all these children, although I do think it's important that they be evaluated. We have at least the opportunity to begin to address this before it actually occurs. So pregnant moms, people in that area, people who are in that stage of life, very important that they understand, hey, there's certain things I can do, not only for my own health at the time, but in speaking to my obstetrician or midwife or whoever it is that you're using, there's some things that you can do. Birth position is a big part of this. Whether it's on all fours or on your back or whatever position you use, and a lot of the tables in the hospitals now in the birthing centers allow for different positions to be explored so that you can not only make the birth easier for the mom, but for the baby. So really important, and what we're going to do is in a minute after the break, we're going to talk about how this affects us, because I said at the top, we would be talking about an illness mentality versus a wellness mentality. And these are different than disease and health. These are the mental states that exist that bring the physical application or the physical expression of disease or health. So this beginning process for all of us, since we all got here through birth, is important that we understand that this could really begin the snowballing effect that sometimes occurs with adults and children. Important for us to understand and begin to kind of look at. And in just a few minutes, we'll come back to this and we'll begin talking about how the physiology is affected, how our focus gets affected, especially when it comes to learning, and what effects that has on us overall.
How far would you go to help someone? Would you go to the end of your driveway? Would you cross a street? Would you cross an ocean? Would you go if you could use your knowledge to teach someone? And in the process, maybe learn something yourself. Life is calling. How far will you go? Peace Corps.
Is how you're feeling inside keeping you from going outside? If chronic diarrhea, severe abdominal pain, or rectal bleeding are tying you to the bathroom, maybe it's serious, like Crohn's disease or ulcerative colitis. See a gastroenterologist. Early diagnosis can make treatment easier. Get on with your life. Get help. Get better. The Crohn's and Colitis Foundation of America. Dignity, hope, and one day, a cure. Contact us for a free information kit.
Sure, my neighbors Jean and Louise, they may be superheroes with superpowers, but that doesn't make them so super at saving energy and money. I mean, I like them and all, but when Jean uses that power vision to cook dinner?
Honey?
Or when Louise or Starbright tries to save a little on the lighting bill?
Mom, a little light?
I may not be able to harness the power of the elements, but I save significant cash and help the environment with appliances, electronics, and windows featuring the Energy Star label. And I improved my home energy efficiency with insulation. My thermostat? Watch this. I'm just kidding. It's programmable. I don't have to lift a finger to save on AC and heating.
Mom, Dad's making fondue again.
So discover your own energy-saving superpowers. Go to ase.org/consumers.
Thank you. Welcome back. We're talking about the basics of an illness mentality versus a wellness mentality. We started off with the KISS syndrome. KISS syndrome being kinematic imbalance due to suboccipital strain. Now, I know that's a mouthful, but what it really means is there's a lot of stress where the head meets the neck. That's in a really important area because that's the part of your nervous system that really coordinates all the functions that you don't have to think about. And when that area is affected, then illness tends to be the outcome, or disease actually. Before we really talk about the disease part of this, I do want to talk about illness because illness is the mental state that precedes a disease state. And you can have an illness state and be a relatively healthy person, just as you can have a wellness state and have a symptom. So it's important that we make this distinction, because a lot of people are walking around kind of in between and not really understanding what the implications of this are. If you have an illness mentality, then your physiology is definitely affected. And what happens is, when that illness mentality is present, our physiology is being affected because we're creating more stress hormones than we normally do. And for most of us, thankfully, it's just it's an event. Something has come up, you're stressed for a little while, you handle it, whether it's these guys with having a test come up or something at your work or office, anything along those lines. You get stressed for a little while, but we tend to come back to center. It's only when we're not coming back to center that this becomes serious, or if those events are lasting for a really long period of time and we don't have the things in place to help us get back to center. So what kind of exercises are you doing? What is your spiritual or meditative practice? Are you having something that's an outlet? Really important, because otherwise that physiology, if stressed long enough, will move into a state of what we call dis-ease. It's not disease. We're going to hyphenate it. It's dis-ease, and the reason we're making the distinction is because when we're healthy and functioning well, we're in a state of ease, meaning we're producing a whole different set of chemicals, and our chemical cascade looks completely different. So our body's building itself rather than tearing itself down. If you think about it, there are times when this state of dis-ease might be really important. If you were stranded in the desert and you had no water and you had no food, but you were trying to make it to the next oasis or safety area, and you started breaking down muscle tissue because you hadn't eaten in so long, that's not a constructive adaptation. But if you've had no food and you need fuel to get you to that next place, that oasis, then breaking down muscle tissue is actually a very good idea. You can't live that way for a long period of time, but it's an okay adaptation for now. So your body never looks at you and says, "You sure you want to do that?" It doesn't question that. It just says, okay, it has to. If it didn't, you'd never survive. You wouldn't get out of the way of the speeding cars. You would be in danger constantly. So your body has to say okay. So what you think or where your mindset is really is an important component to that. And that really takes us to the number 2 point, which is focus. Where is your mindset? Because this is a two-way street. Your physiology affects your psychology, and vice versa. This goes both directions. So psychology and physiology are both being affected. And if your physiology is not 100%, then you're just not going to have a great mindset. If you're aching and hurting all the time, or you're having a difficulty with some part of your body, you kind of get depressed if it lasts a really long time. Or you just may get down, or it might just wear you out. If you are in that worn out state to begin with psychologically, it's difficult for your body to show up. And the reason for that is your brain is constantly making messages or signals. And those signals are going right down through that nervous system that we were talking about a second ago. And all the nerves that come off of each of those levels are now feeding your tissue. So if at the very headwaters of what's going on in your body there's pollution, then down below in the river there's also got to be pollution. It just follows. So this can be changed just as easily, and this can be changed. And most of us seek to shift this through medication. And while that's one option, there are others. Having a healthy nervous system is very much a part of that. And the 3 things that we talk about in my office the most are a clear connection, and that is the healthy nervous system, because no matter how good a thought you want to have, if you can't get it through the system, it doesn't matter. A lifestyle that supports it. In other words, how are you living and where are you putting your focus daily? If you don't have a lifestyle that supports constructive thought and growth, or you're not doing those things, it doesn't just happen by luck. You got to actually do the work. And the last is the lifestyle, the connection, and the focused intent. Where is your focus, and where are you going to take it to, on what level? When you tie them all together, then you have an opportunity to really begin to develop or create your life the way you want it to look. And this has a huge impact on how your body shows up, because your body's really the outcome of your thoughts. And if it's constantly speaking information back to your mind, then your mind is also the outcome of your thoughts, because it is a loop. So if we're in an illness mindset, we tend to focus on effects in life. And when we focus on effects the most, we're focusing on what's going on in front of our eyes. And you might be saying, well, that's all there is, or that makes the most sense. It does initially, and it especially does when we're children. That's why we started this conversation with kids in the KISS syndrome, if they come into this world with a subluxation process or difficult delivery, let's say they're not subluxated, but they do have an event that makes it very difficult, then we're going to tend to focus on them and their effects rather than cause. If you focus on effects most, you're usually living out of fear. Now, I understand that's a broad generalization, and this is just kind of an open approach to this. But if we do live in fear, remember what fear stands for. Fear stands for false evidence appearing, I know you can't read it, real. False evidence appearing real. The more you believe in fear, the false evidence appearing real, the more you're living in that part of your brain, that hindbrain part of your body that just lets you survive. And remember, being in survival is great if you're crossing the desert, but if you're trying to live a life of growth and healing and wholeness, you can't do that if you're in fear constantly. So this makes a big difference in where your focus is and what you're focusing on. If you focus on effects most often, then we're going to be living in this state most often. And so that very simple loop, that very simple cycle of brain's getting a message based on what you see, it's making a distinction by coming from your hindbrain, which tells your body, hey, we're in fear, so let's make this your heart. Speed up. Something's going to attack us. We're in fight or flight. We got to speed up and we got to go, 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 go constantly. Again, this is okay if something really is attacking you. You do need to be in fight or flight, but if it's just a stressor, if it's just a rough day or somebody cut you off in traffic and you move into this state more often than not, you're increasing your blood pressure, your heart rate, and so on. These are the things that predispose us to illness or disease. And disease left long enough is where we move into disease. And we remove that hyphenation. See, if you had some indicator on your body that every time something happened that you knew you were moving in the direction of disease, you'd do something about it like that. And you actually do. We just don't listen to it that often, and that's really just how we feel in here. You know, is it easy to take a deep breath? How are you feeling about that event? Have you organized yourself to the degree that you need to? Pay attention to those things, and the difference that it makes is amazing. And what we're going to do is just in a few seconds here after this commercial, we're going to get rid of all this, and we are going to talk about a wellness mindset and what we can do, some very simple things to take you in that direction so that even if you do have an ache or pain, you can find your way out of that and move into health and wholeness.
Healthy teeth are key to a healthy body. If you have heart valve problems or diabetes, you should take extra care of your teeth. For those with heart valve problems, there's an added risk during dental treatment as bleeding can occur. This may result in bacteria from the mouth reaching the heart through the bloodstream, causing bacterial endocarditis, a serious inflammation of the heart tissue. If you have diabetes, you may be more prone to periodontal disease. Also, diabetes can slow the healing process, which lowers the body's resistance to infection. Providing your dentist with your current health history will help your dentist recommend the best treatment available for your specific needs. By taking care of your teeth and gums and visiting your dentist regularly, you can help prevent infection and stay healthy. For the ADA Dental Minute, I'm Dr. Maria Lopez-Howell.
Is she thirsty or diabetic? Is he tired or arthritic? Subtle behavioral changes can be early signs of disease in pets. These changes are often less obvious in cats, which can be better than dogs at hiding illness. But a wellness exam from your veterinarian twice a year can help detect, treat, or prevent many health problems before they become serious. So call your veterinarian and schedule your pet's wellness exam today.
Your influence, your concern, your rules can help keep minors away from alcohol. Visit don'tletminersdrink.com.
Thank you and welcome back. We're talking about an illness mentality versus a wellness mentality, and we talked about illness and the effects that it creates in the body. especially if it's long-term exposure and moving from a state of health or wholeness toward disease. The midway point to that really is dis-ease, and that's when the body's just not in an ease state. If it's not in a state of ease, then it's having a little bit harder time functioning. You're not broken down. It's when your oil light comes on in your car. Your car hasn't stopped, but if you continue that way, then there is going to be an ultimate symptom that you'll need to address. The nice thing about it is when you begin understanding this process, and that's really what it is, it's a process. When you begin understanding that, then you understand how to be in control of this process and make different decisions, which really change how your life looks, whether it be your health or your relationships or anything else, because they're all connected. You can't separate any one of these. So let's talk about physiology, since we're talking about connecting everything. We talked about it in the illness framework of saying if you're constantly stressed, you produce certain hormones. Well, when you're in a wellness mindset, you're doing the same thing. You're producing certain hormones. In this case, you happen to be producing hormones and neurotransmitters, which are just signals. They're carriers, just like you're receiving this broadcast. They're carriers that take you in a direction. If you produce more carriers that are positive, then you move in the direction of health, wellness, and wholeness. If you produce more that are negative or stress-based, then you move in a state of dis-ease. Now, we do have to make a distinction. There are stress-based chemicals that are good. We're talking about this again in a generalized framework here. You can have, if you go to the gym and work out, you're stressing out your body, but the beauty of that is that when you come home and you rest, it actually builds itself to a higher degree. Some people thrive on stress. If that happens to be your mentality or your personality, and you balance that with activities that allow you the healing time necessary, then it's not the end of the world. We're not saying you have to drop everything you do, but being aware of how the process works and really finding what it is that fuels you allows you to refine the process to make it work better for you, so that you're not spending half your day moving in this direction and half your day moving in this direction, leaving you with net movement of nothing. This is where frustration moves in. And when we have frustration, then it again begins to take us back in this direction. Symptoms occur, and we begin changing how we're focusing and really how our body's responding. So let's go to focus. Really important. If we're not looking at our focus, then we can't be clear of what physiology we're going to show up with. So your focus is really important. What are you focused on the majority of the day? What are you giving your attention to? Are you going to sleep at night listening to the news? Remember, the last thing you hear, the last 30 minutes before you go to bed, is what you process during your dream time. That sleep time or dream time, you only get into that dream state if you move into that rapid eye movement state or REM sleep. You only get there if you're in a deep, relaxed state. So that's when you heal. So what are you doing before you go to bed? Are you eating too much? All that blood has to move to the stomach and the digestive system to help you break down that food. And again, that's less oxygen for the brain, less time to really shift down or gear down a little bit so your body can do what it needs to heal. So bringing your focus to things that you know are constructive and that help you is really important. Think about what that looks like in your life, and even if it's just something as simple as reading a book that you really like or find inspiring, going to a show that you love, a movie, something that's uplifting, not something that's going to be really draining, fear-based, or adrenaline pumping before you go to bed especially. And last is going to be cause, because that's what all of these things lead to. They lead to cause. What is your focus is going to be based on cause. In illness, we talked about the fact that you end up focusing on the effects in your life. But if you're in a wellness mindset, you're focused on cause. And let me give you an example of what this means. If somebody comes into the office to me and says to me, my knee's really bothering me today. Okay, well, how do you feel about that? Not how does it feel. I'm not looking for a description of the pain in the knee. How do you feel about that event occurring? And what we're really saying is, are you in a wellness mentality or are you in an illness? Because you can have a cold and have an illness mentality and tell me, yeah, it's just a cold now, but I know I'm going to have pneumonia next week. And we all have people in our family like this. They're just doom and gloom constantly. And guess what? They have usually the worst health. So it's not by accident or luck. If you have that same person who says, yeah, you know what, my knee's kind of bothering me, but you know what, it'll be fine. I overdid it. I was landscaping, or I shoveled some snow in this case. And I twisted a little bit, but I know it'll be fine. Let's just do what we need to do. That's a totally different approach. That's a wellness mentality. And so while that body is being stressed physically, yes, that's true, they're staying focused on what they know they need to do, which is heal. And so if you can do that, then more often the majority of your energy is moving continually in this direction. And that makes a big difference. So really ask yourself, am I getting up every day looking at the world going, hey, this is a possibility-based place. There's all kind of opportunities for me. And I know things are going to go well because I know I've got the right framework. I've got the right frame of mind. That doesn't mean there's never any bumps in your road. It just means you learn how to handle them differently. And that's a big, big part of this. And if you're thinking, well, what the heck does that have to do with chiropractic? Remember, we started this show talking about KISS syndrome. KISS syndrome, one more time, is kinematic imbalance due to suboccipital strain. I just like saying it. The point of that is, if you are in a subluxated state, this is much more difficult to wake up every day and say, hey, I know what's possible for me today. Remember, psychology affects physiology and physiology affects psychology. So if you're stressed and your body's feeling it, it's difficult to get up and say, hey, I'm ready to go. So if you can really begin to shift your framework, you can see this in a different perspective. The big deal for our kids are, though, because we started talking about the little girl with ear infections, is if they can learn this when they're little, if we can teach this to them, the opportunity it creates for them is huge. And they don't end up going through the majority of the effects that we had to go through because our parents didn't know this stuff. So you just knowing this, living it and passing it on. Gandhi, one of my favorite expressions, is become the change you wish to see in the world. The best way to teach something is to become it. Do it yourself. Don't tell them about it all day. Show them. It's fine to be told something, but you never get something so well as you do when somebody teaches it to you, or they show you that it's possible. And when that happens, big, big, big changes occur. And really, just to close with, Roger Bannister ran the 4-minute mile. We mention this often. The interesting thing about that was everybody said it was impossible. The beauty of what Roger Bannister did is he broke through that barrier. And when he did, the people that he'd been running side by side with that same year who couldn't run the 4-minute mile ran the 4-minute mile the next year. How will you break barriers for your kids? Will you be in a wellness mentality or an illness mentality? The choice is yours. Have a wonderful day. Thank you.